Let's discuss about diphtheria. What is diphtheria? Diphtheria is an infectious disease caused by the bacterium Corynebacterium diphtheriae. The germ produces a toxin. It can harm or destroy human body tissues and organs. One type of diphtheria affects the throat and sometimes the tonsils. Another type, more common in the tropics, causes ulcer on the skin. Diphtheria affects people of all ages, but most often it strikes unimmunized children. Most infections occur during the colder months. In 2000, 30,000 cases and 3,000 deaths of diphtheria were reported worldwide. How is diphtheria spread? Diphtheria is transmitted from person to person through close physical and respiratory contact. It can cause infection of the nasopharynx, which may lead to breathing difficulties and death. What are the signs and symptoms of diphtheria? Early symptoms are sore throat, loss of appetite, and slight fever. Within 2 to 3 days, a bluish white or gray membrane forms in the throat and on the tonsils. The membrane sticks to the soft palate of the throat and may bleed. If there is bleeding, the membrane may become grayish, green, or black. The patient may either recover at this point or develop severe weakness and die within 6 to 10 days. Patients with severe diphtheria do not develop a high fever but may develop a swollen neck and obstructed airways. What complications occur in diphtheria? At the beginning, the illness or even weeks later, patient may develop abnormal heartbeats, heart failure. Some experience inflammation of the heart muscles and valves. Leads to chronic heart disease and heart failure. Most severe is respiratory obstruction followed by death. How do we treat diphtheria? Give diphtheria antitoxic and antibiotics such as erythromycin or penicillin. Isolate to avoid exposing others to the disease. About 2 days after starting antibiotic treatment, patients are no longer infectious. For confirmation of diagnosis, health workers should obtain throat culture from suspect cases. Treatments should begin without waiting for culture result. How can we prevent diphtheria? Improve immunization coverage in the community. In most countries, diphtheria toxic vaccine is given in combination with tetanus toxoid and pertussis vaccine (DPT) vaccine. More recently, some countries have been using a combination vaccine that includes vaccine for diphtheria, tetanus, pertussis, hepatitis, and sometimes Haemophilus influenza type B. Approximately every 10 years, booster dose of the adult form of the vaccine, tetanus diphtheria toxoid vaccine (TD), may be needed to maintain immunity. Thank you. This much for today.